I'm Reed Magnum with Magnum Media. We're talking with Sara Horras, orthopedic physician assistant at SSM Health in Baraboo. Sara, when it comes to patient interaction and care, which I know for you is a really the important part of this whole thing, how do you ensure there's effective communication with the patients, especially when you're having to explain some pretty complex orthopedic procedures?
Yeah, I think it can be really helpful to either have a model of the specific joint or body part you're talking about. I think either drawing diagrams or having a pictorial diagram can really be helpful to explain things for people. Definitely allowing time for them to answer or to ask any questions that they might have.
It seems to me like nervousness is going to play a part when people are about to go into any of these procedures, but it does seem like when it comes to a patient, the more that they can understand, the more their family can understand about what this is going to look like. It seems like that's going to help that healing journey.
Yeah, I mean, definitely, a big part is really listening to the patient. Trying to really understand what their problem is, what brings them in. I see a lot of people with knee pain, but they have different goals for that pain and what they want to accomplish. So definitely a big part of how to treat them is listening to what their concerns are, allowing them to ask questions, and really, taking the time to get to understand your patient.
So they have the procedure, they're doing whatever it is, and then you got that healing journey part of it. What role do you play as an orthopedic physician assistant in a patient's healing journey, from diagnosis all the way through to recovery?
Yeah, again, like I touched on, I think really, listening and to what they have to say, what their concerns are, that can tell you a lot about what is going on with them and the best way to help them. I think definitely being able to answer any questions that they have. They can always call our clinic if they have concerns that come up between their appointments, or certainly using my chart is a really great way to reach out to us, and sometimes quicker too than trying to reach us via phone. But yeah, otherwise I think it's really important to just make sure that they feel like they can reach us, and even between appointments.
Success there is going to look different for every patient depending on what their situation is. How do you measure success in your role, both for yourself and the patients you're caring for?
I mean, I think for me, I want to know that my patients feel happy with their visit, that they felt like they were listened to. Sometimes it's hard because we don't always have the perfect solution for them, but if you can listen to them and feel like they feel like they were cared for, or maybe have some other alternatives or options, I think to me that's one measure of success. Certainly getting people back to their active lifestyle is a big part of what we do. So I like to see, that we can take away somebody's pain, whether it be through an injection or a surgery, and get them back into, maybe it's just being able to walk their dog around the block, or maybe it's getting them back to, playing pickleball or something. I think those are certainly successes.
For someone who wants that success, they're seeing this and they want to be able to do something as simple as walk their dog again. What's the best way for them to make an appointment with SSM Health Orthopedics in Baraboo?
Yeah, so they can either call our clinic at 608-294-6464, or they can log on to our website, ssmhealth.com, search for orthopedics, and type in their zip code, and they'll find our information there.